This video is based on my extensive experience as a physical therapist since 1962, a yoga practitioner since 1977, and a Kripalu certified yoga teacher since 1984. I have developed a comprehensive, safe, and therapeutic exercise and movement program, including modified yoga, for persons with osteoporosis and low bone mass. This video begins with simple movements which will lead into more complex yoga postures. And the movements complement the use of the SpinoMed orthosis.
This video is the demonstration of a yoga-based fitness program which, once you've learned it, will take about 10 to 15 minutes. The focus is on lengthening and strengthening the back muscles and the back itself, which will complement the use of the SpinoMed orthosis. So the trainer is going to instruct the patient on how to get down to the floor onto the exercise mat in a safe way. The trainer begins by teaching the patient how to come down into a lunge position, taking care to keep the back in alignment, doing the hip hinge movement to bring the hands down towards the floor. The patient will lie down onto the abdomen, extend out the left arm, and roll over onto her back and be in the center of the mat. She will then bend her knees and hips to bring the feet flat on the floor. Turn the palms of the hands upwards and bring them halfway between the shoulders and the hips. She is now ready to begin the exercises. The next exercise is called the shoulder press, and the trainer will instruct the patient in determining the distance between the back of the shoulder and the mat on each side, so that when the patient does the exercise, she will have an idea of the direction to move the shoulder and how far to go. Because people tend to hunch the shoulders when they move the shoulders, the trainer will then have the patient lengthen the arm, each arm, and then return to a more relaxed shoulder position. After this, we begin to teach diaphragmatic breathing, placing the hand lightly on the abdomen at the level of the navel and instructing the patient to expand the abdomen as they breathe in and contract the abdomen as they breathe out in a relaxed fashion. After they learned the diaphragmatic breathing, then we want to teach them to coordinate the breath with the movement. So the patient will take a breath in and then, on the breath out, extend through the collarbones, bringing the collarbones out and into the shoulder press movement, holding for 2 or 3 seconds, and then relaxing as she breathes in again, and then lengthening through the collarbones and pressing the shoulders again on the breath out, holding for 2 or 3 seconds and relaxing on the in-breath. So breathing in with the relaxation and out with the effort. Coordinating breath and movement is one of the essences of yoga. The next exercise is the head press. So the trainer will check the alignment of the cervical spine of the neck, making sure that the patient has an arch in the neck before doing the exercise, and then instruct the patient in how to check for that arch herself. After we determine there is an arch in the neck, she places her hands back in the beginning position, lengthens out through the arm, again to avoid the hunching of the shoulders. The next instruction is that the trainer will place her hand lightly on the bottom of the chin and instruct the patient to keep the chin in position as she feels the weight of her head on the floor and presses the back of her head into the floor. So pressing the head, 2, 3, and then relax. And then coordinating the head press with the breath, the patient takes an abdominal breath in and then breathes out, pressing the head, press, 2, 3, and relax. And the patient can repeat this movement 3 to 5 times before moving on to the next exercise. The next exercise is called the leg lengthener leg press combination. So the trainer is going to instruct the patient to slide the heel out by straightening one leg. Adjust the position of the foot by pulling the toes and forefoot towards the knee, extending through the heel. And then lengthening the leg from the pelvis. And while the leg is lengthened, pressing the leg into the floor as if to make an indentation in the floor that looks just like the leg. Hold 2 to 3 seconds and release the tension. And then, making sure the foot and legs are still in alignment, lengthening the leg again and taking a breath in, and then lengthening on the out breath and pressing the leg into the floor. Press, 2, 3, and release. Return the leg to the starting position by sliding the heel up. Slide the other foot out. Adjust the position of the foot, pulling the toes and forefoot up, extending out through the heel, lengthening from the pelvis, and then holding the leg in the lengthened position, pressing the leg into the floor. Press, 2, 3, and relax. And then a repeat, coordinating with the breath, breathing in and then lengthening the leg and pressing at the same time, breathing out. 2, 3, and then relax. And then returning the foot to the starting position by sliding the heel up along the mat. And this exercise can then be repeated on each leg 1 or 2 times for a total of 4 to 6 lengthener press combinations. The upper body remains in position throughout the exercise. The next exercise is called morning stretches. So the trainer is going to instruct the patient to bring the arms close to the body with the palms facing the body. One arm is raised up in the air alongside the head, keeping the elbow as straight as possible and not trying to touch the floor with the hand. The same leg is straightened down to the floor. The adjustment is made to the foot, pulling the toes and forefoot up, heel out, and the patient is instructed to lengthen the arm and the leg together by separating the ribs and the pelvis. Hold and release. And then, to coordinate with the breath, take a breath in and, on the breath out, lengthen arm and leg at the same time. Again, separating the ribs and the pelvis. Hold and release. Bring the arm down to the side, keeping the elbow straight, and bring the foot back to the starting position. On the other side, the patient brings the arm up alongside the head, elbows straight as possible, not trying to touch the floor. Straighten the same leg by sliding the heel out, toes and forefoot up, heel out. Lengthen the arm and the leg at the same time by separating the ribs and the pelvis, and then taking a breath in and lengthening with the breath out. Hold, release. Bring the arm down and bring the foot back into the starting position. Go back to the arm that we started with and bring that arm up alongside the head. Elbows straight as possible, not trying to touch the floor. Straighten the opposite leg down to the floor. Adjust the position of the foot. Breathe in, and as you breathe out, lengthen the arm and the leg at the same time. Lengthen, hold, and relax. And bring the arm back down and the foot to the starting position. Bring the other arm up alongside the head, keeping the elbow straight, not trying to touch the floor, palm turned towards the body. The opposite leg down to the floor, adjust the position of the foot. Breathe in and lengthen the arm and the leg at the same time. Lengthen, hold, and release. Keep the already straightened arm and leg where they are, and now straighten the other leg down and keep the other arm up, so both arms are along the head and both legs are straight. Adjust the position of the feet, so toes and forefeet are up, heels are out. Big breath in, and as you breathe out, lengthen through the pelvis and the rib cage, making yourself as tall and long as possible. Lower the arms back down to the sides of the body. Bend your knees, bringing the feet back into position. Turn the palms up and do a shoulder press as a finishing movement. In this exercise, the student has the palms of her hands turned towards each other, with the thumbs facing upward. This position was demonstrated because it is the neutral position of the shoulder and less likely to cause shoulder discomfort. This exercise can also be performed with the palms facing downward at the start and then facing upward when the arms are alongside the head. The next part of the exercise program is done in the prone position, lying on the abdomen. We've prepared the mat with 2 towels to support the hips and the forehead. So the trainer will have the patient rolled slightly to the opposite side and wedge the towel underneath the hip. Then the patient will bend the right leg, placing the foot on the floor so she can push with the foot to turn into the prone position and end up lying on the abdomen with the towel under the hip crease and also underneath the forehead. The trainer will check to see that the neck is in the neutral position with a slight arch, and that the arms are at a 90-degree angle from the body with both the shoulders and the elbows. The legs are straight and extended parallel to one another, and the trainer will help the patient lengthen out the legs for maximum length of the body for exercise in this position. So we are now ready to start the exercises in the prone position. So the first exercise we do in this position is called the pelvic press. The trainer indicates to the patient that her hips are resting on the towel and instructs her to feel and increase the pressure of her body on the towel. This exercise is not a pelvic tilt, it is a pelvic press. By pressing the pelvis into the towel, this triggers contractions of the hip and the lower back extension muscles. The patient holds the press for 2 or 3 seconds and then releases. When this exercise is done correctly, the patient will feel a little lift in the legs and perhaps even in the upper body in some people. It's the beginning of stabilization for other exercises in the prone position. The next exercise in the prone position is called the head lift. So what the patient does is imagine that she is looking in a mirror and she can see her whole face in the mirror. And then, without using her arms or tilting her head, she lifts her forehead straight off the support. Lift, hold, and relax. And as she lifts, you can see it's a very small movement. The trainer can assist her by giving her a little feedback with her hands that the movement is at the hairline. So let's do that one more time. During the lift movement, you can clearly see the muscles in her neck, the upper back extensors that support the head against gravity. The next exercise in this position is the upper body lift. So the trainer is going to assist the patient in bringing her arms down along the sides of the body, palms facing up, arms parallel to the body with the elbows straight. This is usually the first exercise in this position. It is the easier one of the positions to do. We begin with the pelvic press, so the patient is instructed to press the pelvis into the towel. And then to do the head lift. To squeeze the shoulder blades together. And then to lift the hands off the floor just so they're in alignment with the body. Lift the chest up, hold the position 2, 3, and then relax down. By doing the pelvic press, the head lift and squeezing the shoulder blades together and then lifting the arms, we engage the back extensors all the way from the tailbone up to and including the neck muscles. The upper body lift can be done in more advanced positions with the arms in different positions. The first position would be to clasp the hands behind the back by interlacing the fingers and squeezing the shoulder blades together. Another position would be to place the arms at a 90-degree angle from the shoulders with the elbows bending at 90 degrees. This is called the W position, like the letter W. The patient is instructed to squeeze the shoulder blades together as she lifts the arms off the floor. Keep the head down, squeeze, hold, and relax. The next position is called the airplane position, the arms out at the side. And so, as she lifts the arms, she squeezes the shoulder blades together, hold, and relax. The last position we'll demonstrate here is with the arms up alongside the head, the elbows straight as possible, keeping the head down, lifting the arms off the floor. Lift, hold, relax. And she can then have the palms either facing each other or the palms facing down. So let's do both. So turn the palms facing each other. Lifting arms, lift, hold, and down. Turn the palms down towards the floor. Straighten the elbow a little bit more. Lift, hold, and relax. In the sequence of upper body lifts, several arm positions are demonstrated. In each arm position, the student should do the pelvic press and head lift, and, except for the arms alongside the head position, the student should squeeze the shoulder blades together. After that, the student should lift the upper body. The version with the arms alongside the head is the most difficult. And now it's time for the trainer to get the patient up off from the mat. So the trainer instructs the patient to bring her hands down to chest level, cupping the hands so that the weight of the arms is on the bones of the hands and not on the joint. We begin with the pelvic press, so we press the pelvis, and then lift the upper body, lifting the chest first, coming as high with the chest as possible, then lifting the hips, walking back, and coming into a full kneeling position. Bringing one foot forward, pressing into the foot, and coming to a stand. We now have the patient standing in the medi active, and this you can see has a back support that runs up the back from the sacrum, the lower back, all the way up nearly to the neck. So this helps give support to the back. And now the trainer will have the patient turn around and demonstrate standing balance called the tree. So the patient stands on one leg, brings the other leg up with the sole of the foot next to the leg, and brings the hands together in front of the chest. And does this exercise on both sides.